Most people over the age of 50 think that they're getting enough vitamin D. You may live in a sunny place, or go walking outside, or even take a supplement. And yet, the blood work often still shows deficiency. So what's going on? And why does it even matter? When most people think of vitamin D, they think of bones. And while that's really important, it's not just about bones. It's about staying strong, sharp, and resilient as we age. It does help your bones because it helps absorb calcium, and lower D is associated with a higher rate of fracturing or breaking a bone. But low vitamin D is also linked to muscle weakness and falls, which definitely increase as we get older. Low vitamin D can affect your balance too. And that's not even related to your bone density or how thick your bone is. Low vitamin D is also associated with fatigue and low mood, which for some people tends to happen as they get older. And this could be one of the causes. But also your immune system. When you have lower levels, it could correlate with a higher infection risk or even worsening of some autoimmune diseases, like the ones that I treat. Now, that doesn't mean that vitamin D prevents autoimmune diseases or is the magic bullet to prevent colds and infections, but it does suggest that deficiency may influence the immune system. This is why it can be so important to actually check your vitamin D levels when you go to the doctor. I live and practice in a very sunny state. Even in our winters, it is so warm you usually don't even need sweaters. And my patients are out golfing or doing other activities outside. They're walking, exercising, and yet they're still deficient. Why? Well, one of the reasons is as we get older, our skin is unable to convert that active form of vitamin D into something usable for us. So you could be getting the same amount of sun as when you were 20 years old, but it's just not converting it to the right form for you to actually be able to use. Sunscreen. We tell everybody to put sunscreen on. We don't want to get skin cancer. And yet that's also blocking the sun for us. And timing matters. If you're going out early in the morning or late in the evening, it's not that strong sun that is helpful for vitamin D. And especially if you're wearing a lot of clothing when you go outside, you're covering your arms and legs, then you're not going to get all of that vitamin D. Sometimes you go from your car to the store or to work, and then you come back and yeah, you were outside, but you really weren't getting enough of vitamin D. You weren't staying there. Also, sometimes your weight or body fat can influence your vitamin D. So if you're very overweight, higher body fat equals more sequestration of the vitamin D, because it's a fat-soluble vitamin, so it really does get stored and you're not able to use it. What about living in some countries where there's a lot of pollution? So with the smog, you're not getting good sun rays through that smog and you're not getting it to your body. The rate of vitamin D deficient is different depending on where you live in the world. In the United States, it's anywhere from 35% to maybe 50%. But in India, it's almost up to 90% because there's so many factors at play here. So where you live does matter, and sunshine alone doesn't fix it. But there are a lot of symptoms associated with low vitamin D. Sometimes they're very subtle, but you can get this chronic fatigue, feeling tired all the time, achy, your muscles can feel really achy. You can get pain in your bones all over the body, actually. You can be getting more frequent colds or infections, or if you have autoimmune disease, then more flares of your disease. You could be feeling weaker than you should be feeling at this age. A lot of times people think when they feel this way that it's because they're getting older. It could be something as simple as having a very low vitamin D. But you can't really know just by thinking, hey, I match all these things in the checklist. The only way to really know is to get a blood test. That's the most reliable way. So what level is actually normal? Different labs have different values. So around me, most of the time they'll say from 30 to 100 nanograms per milliliter is considered normal. But normal doesn't always mean optimal or the best. Certainly if you're below 20, you're deficient. If you're from 20 to 30, it's not as terrible, but it is insufficient. 30 to 50 is usually enough for most adults. And I definitely have people that are taking way too much vitamin D and they're over 100. But these extremely high levels can be harmful. More is not necessarily better. And we do not have studies to say that if you took a higher level of vitamin D, you're going to feel better. It's not there. So just be careful with that. So here's a 4-step fix because it is a very fixable issue most of the time. Test first. Don't just guess. Sun smartly. If you're trying to increase your vitamin D, and yes, it is not a good idea to overdo it because it does increase your risk of skin cancer. But if you're trying to get more, midday sun is helpful. You don't have to do it for a very long time, just a short time, but expose your arms and your legs if you're comfortable with that. Food sources can definitely help, whether it's fatty fish or fortified dairy. So sometimes when you drink your milk, it is fortified with vitamin D, and it usually says it right on there. Well, what about foods like mushrooms? You may have heard that they have a high amount of vitamin D. The problem with that is that when you go to the store, those mushrooms that are there don't usually have a very high amount because they're grown in the dark. But mushrooms do contain ergosterol, which turns into vitamin D2 when it's exposed to UV light. It's kind of like how our human skin makes vitamin D, just a different chemical. So if you wanted to get them from your vitamin D, so you could get them from mushrooms, but they'd have to be wild mushrooms or UV treated mushrooms because those can give more meaningful amounts. You can try putting your sliced mushrooms on a tray in the midday sun for about 15 to 30 minutes, and that can help boost their vitamin D content, almost like a supplement. And if this doesn't work, it's okay to take a supplement. Most of the time people take about 1,000 to 2,000 international units, and that's a lot of people even without testing because people are often deficient. But then it's individualized. If you do a blood test and you're still super low despite taking that, then you might need a much higher level. Or if you had certain procedures like a gastric bypass, it can be really hard to absorb that vitamin D. You may need it in different forms, whether it's liquid or injection, some other way. The real problem isn't that vitamin D doesn't work, it's that people assume that they're fine without checking. So if you're not feeling well and you're not sure of what the cause is, this is one of the tests that you can easily check and fix just as easily most of the time. So if this was helpful for you, please comment. Have you checked your vitamin D level recently? And share with somebody who likes getting practical health breakdowns as we age. And stay tuned for my next video on common issues as we age. I'll link it right here. I'm Dr. Bhanusali. See you next time.